Synthesis of steroid hormones. There are 5 kinds of steroid hormones: progesterone, aldosterone, glucocorticoid, testosterone, and estrogen. Active form of vitamin D3, which is 1,25-dihydroxyl cholecalciferol, is also a steroid-like substance. All of these are derived from cholesterol. Cholesterol is a 27-carbon molecule. Its antenna-like structure starts from the carbon number 20. Removing the antenna carbons and converting hydroxyl group into ketose group from cholesterol yields into different type of hormones. Aldosterone and glucocorticoid are 21 carbon molecules. Androgens is 19 carbon molecule. Estrogen is 18 carbon molecule and a ring because of aromatase. Adrenal glands cortex outer cells are called zona glomerulosa, responsible for cholesterol molecule synthesis into aldosterone. The middle part of adrenal cortex is made of long fasciculi and called zona fasciculata, responsible for cholesterol molecule synthesis of glucocorticoid plus a little bit of androgens. Okay, so cholesterol enters the body. A protein named STRAS, stridogenic acute regulatory protein, takes the cholesterol to mitochondria. In mitochondria, there is decimolase present. This decimolate is stimulated by zona fasciculata and zona reticulata. Both zonas are stimulated by anterior pituitary's ACTH, adrenocorticotropic hormone. Now the 21 carbon molecule will be called pregnenolone. Pregnenolone comes out in the cytosol. It will be converted into progesterone. Now to remove hydroxyl group from it, the enzyme is 3-beta hydroxy dehydrogenase. From progesterone, still 21 carbon compound, there will be 3 pathways for cholesterol molecule: aldosterone, glucocorticoid, or androgens. Aldosterone controls sodium and potassium in urine. Androgens affects on testosterone or estrogens. If cholesterol is hydroxylated on 17th carbon by 17-hydroxylase, it is going for glucocorticoid pathway. It's 21 carbon compound. If cholesterol is hydroxylated on 17th carbon and cut the molecule from carbon 20 with the enzyme called 1720 lyase, now it's heading towards creating sex hormone. It's now 19 carbon compound. If 21 beta hydroxylase affects the cholesterol, it's going for aldosterone pathway. Glucocorticoid pathway. After progesterone, if molecule takes 17 hydroxylase, then 21 hydroxylase, and then 11 hydroxylase path, it will make glucocorticoid pathway. Mineralocorticoid pathway or aldosterone pathway. After progesterone, if the molecule takes 21 hydroxylase, 11 hydroxylase, 18 hydroxylase, and then dehydrogenation, it will head towards the aldosterone pathway. Sex hormone pathway. After progesterone, if molecule takes 17 hydroxylase and 1720 lyase path, the molecule is heading towards the sex hormone pathway. While on the sex hormone pathway, the molecule is now 19 carbon molecule and called dehydroepiandrosterone or DHEA. And after some more modifications, it will be androstenedione. This DHEA and androstenedione are weak androgens. These both can come out in the blood and are called adrenal androgens. From here, if it goes to the testis, it will make testosterone, or in females, it will convert into estrogen from the help of aromatase. By the way, decimolase can be inhibited by ketoconazole, which is a fungal infection cream. Deficiency of 17-alpha hydroxylase happens because of the defective gene from mother and father. Sex hormones will be less, male will be born with female-like genitalia, and if female, secondary sexual characteristics will not develop. Less glucocorticoid will lead to hypoglycemia. Because glucocorticoid affects anterior pituitary to stop secreting ACTH. ACTH production will go high, resulting in more decimolase, and because glucocorticoid pathway is not functioning properly, mineralocorticoid pathway will be overly stimulated, which will lead to sodium and water retention, which will cause high blood pressure. Potassium will be excreted in urine and alkalosis will happen. Now renin production from kidney will go down, and in lungs angiotensin will not be converted in angiotensin 1, resulting in less production of angiotensin 2. Angiotensin 2 controls aldosterone pathway's last segment, so the production of aldosterone pathway will be affected. If ACTH is high and glucocorticoid is low, congenital adrenal hyperplasia or adrenogenital syndrome will occur. This will happen with the shortage of either 21-hydroxylase or 11-hydroxylase, so there will be excess of sex hormones. If only 21-hydroxylase is effective, mineralocorticoid pathway will go down. Now sodium and water retention will be low, means less extracellular fluid, means low blood pressure. Licorice is a drug which inhibits the conversion of cortisol, which has mineralocorticoid activity, into cortisone, which does not have mineralocorticoid activity. If we are taking this drug, body will have more mineral activity, more retention of salt and water, and will develop high blood pressure. Mineralocorticoid deficiency can be dealt with fludrocortisone. Glucocorticoid deficiency can be dealt with dexamethasone. Just a reminder, 11-hydroxylase deficiency leads to sodium and water retention and high blood pressure.